Early warning signs of colon cancer you should not ignore. It is often referred to as the silent killer because symptoms may not appear until the tumor has grown significantly, causing complications. In the United States, there are over 100,000 new cases of colon cancer reported annually, making it the third most common cancer in both men and women. It accounts for nearly 50,000 deaths each year. This video discusses 9 early signs of colon cancer, some of which may be subtle while others are more apparent. Number 1. Changes in bowel habits. The first sign to watch out for is changes in bowel habits. The typical age for developing colon cancer is around 60 years old. Although the majority of individuals diagnosed with colon cancer are over 65 years old, it can also affect younger people. Bowel habits are often an early indicator of colon cancer. A healthy colon usually results in regular bowel movements occurring every day or every 2 days, with soft, brown stools that are easy to pass and contain no blood. If you observe any alterations in your bathroom frequency or experience difficulties passing hard stools, it may be a cause for concern and should be investigated further. Number 2. Diarrhea. The second sign is diarrhea. It is a frequent issue for individuals with colon cancer. Diarrhea is technically defined as the occurrence of 3 or more loose stools within a 24-hour period. However, diarrhea can also be a symptom of other conditions such as irritable bowel syndrome, lactose intolerance, or inflammatory bowel disease. According to the National Cancer Institute, some individuals may experience diarrhea due to bacterial or parasitic infections in their colons. Number 3. Constipation. The third sign is constipation. It is well known that the colon is responsible for eliminating waste and absorbing water and nutrients from the food we consume. However, there are instances when the colon becomes obstructed and unable to function properly, resulting in constipation. Constipation can be uncomfortable and embarrassing, and although it may not initially appear as a significant issue, it can be an early indication of colon cancer. In fact, a study revealed that over 80% of colon cancer patients had experienced constipation prior to their diagnosis. Several factors can cause constipation, including medication side effects and a lack of physical activity. Sometimes it can be challenging to distinguish between normal constipation and a more serious condition like colon cancer. If you are experiencing constipation lasting longer than 3 days, particularly if accompanied by other symptoms such as bloody stools and abdominal pain, it is important to consult your doctor. Before we move on to the next symptom, we would appreciate it if you could like our video and subscribe to our channel to stay updated on our informative content. Number 4. Blood in your stool. The fourth sign is the presence of blood in your stool. Colon cancer has a high treatability rate if detected early, with a 5-year survival rate of 95%. Unfortunately, 1 out of every 20 Americans will develop colon cancer in their lifetime. Detecting it early significantly increases the chances of survival. Blood in the stool can serve as an early indication of colon cancer. The colon, which stores stool before elimination, is a part of the digestive system where this symptom may arise. Bloody stools can be caused by various types of cancer and other conditions like ulcerative colitis, diverticulitis, and hemorrhoids. Typically, blood in the stool is a result of inflammation or injury in the large intestine. It can also originate from bleeding in other parts of the digestive tract, such as stomach ulcers. Certain medications, including antibiotics like ciprofloxacin, anti-diarrheal drugs like lactulose, or iron supplements, can also lead to a bloody stool. Number 5. Bleeding from the rectum. The fifth sign is bleeding from the rectum, which could potentially indicate colon cancer. The rectum, the final segment of the large intestine measuring approximately 5 inches in length, is responsible for the elimination of waste from the body. However, it's important to note that rectal bleeding is quite common, and the majority of individuals experiencing this symptom do not have colon cancer. Several other conditions can cause bleeding in this area, such as hemorrhoids and anal fissures. Additionally, bleeding from the rectum may be a result of polyps or other growths on the surface of the colon. Number 6. Unexplained bloating or abdominal pain. Colon cancer can be influenced by both genetics and lifestyle choices, such as diet and exercise habits, which can increase the risk by up to 30%. Genetics account for 10 to 15% of all colon cancer cases, while other factors like poor diet, obesity, smoking, and alcohol use contribute to a 5 to 10% increase in risk. Bloating is a common symptom of colon cancer, and it can manifest in the early stages of the disease or be a symptom of unrelated conditions. Bloating refers to a sensation of fullness or swelling in the abdomen, often caused by the presence of gas. Certain foods or medications can also contribute to bloating. If you experience a swollen belly after eating, it may be helpful to consume smaller, more frequent meals throughout the day instead of 3 large meals. This approach can prevent overeating and assist in managing blood sugar levels while reducing bloating. Number 7. Feeling constantly tired. Feeling constantly tired is a common occurrence, and there are various factors that can cause it, such as staying up late or not getting enough sleep. However, if you find yourself frequently tired and the feeling persists even after a good night's sleep, it may indicate an underlying issue with your health. Colon cancer symptoms typically develop slowly and may not present clear warning signs. The colon plays a vital role in eliminating waste from the body through stool. When this process is obstructed or slows down, it can lead to the accumulation of toxins in the digestive system. If this condition persists over time, it can result in cancerous tumors forming in the colon wall. If you experience persistent fatigue along with other symptoms like bloating or abdominal pain, it could potentially be an early indication of colon cancer. Number 8. Sudden weight loss. Sudden weight loss is one of the potential symptoms of colon cancer, although its occurrence can also be associated with other gastrointestinal diseases. The specific symptoms of colon cancer can vary depending on the location and stage of the tumor. However, it's important to consider other factors that can contribute to sudden weight loss. For instance, older adults who have recently recovered from an illness may naturally shed some extra pounds, which is considered normal. Nevertheless, if you have lost more than 10 or 15 pounds within a span of several months, it could potentially indicate a sign of colon cancer. Number 9. Feeling full all the time. Experiencing constant feelings of fullness can be a sign of an underlying issue with your digestive tract, potentially related to colon cancer. While adopting a healthy diet can help reduce the risk of developing colon cancer, it may not be sufficient on its own. Regular exercise is also important in prevention. Colon cancer can lead to various digestive problems, including bloating, constipation, diarrhea, and difficulties with normal eating. Initially, these symptoms may be mild and easy to overlook or dismiss compared to other signs of colon cancer. Regardless of your age, maintaining a healthy diet, engaging in regular exercise, and maintaining a normal weight are the best preventive measures against colon cancer. Additionally, if you have a first-degree relative, such as a parent, child, or sibling, who was diagnosed with colorectal cancer before the age of 55, your personal risk is higher. Having 2 first-degree relatives with a similar diagnosis further increases your risk. African Americans have a higher risk compared to other races and ethnicities in the United States, although this disparity may be influenced by differences in access to screening tests rather than solely biological factors. While these may serve as early signs of colon cancer, they are not definitive symptoms. Thank you for watching. If you enjoyed this video, please like and subscribe to our channel for more informative content like this.